Assalamu alaikum. Today I am going to describe the MUSE chart, that is the modified early obstetric warning scores. This is an standardized risk assessment tool to identify obstetric patients who showing signs and symptoms of clinical instability before their conditions deteriorates. This tool is based on physiological indicators, routine observations, and detects changes in a patient's physiology, which will be reflected in a change of score should the patient be improving or deteriorating. The higher the score, the more intervention and support required. MUSE is used for obstetric patients, that is, pregnant women until 6 weeks postnatal. What are the purpose of this score? To improve the process of patient observation and monitoring. By doing this score, we improve the communication within the multidisciplinary team with regards to changes in patient's healthcare status, to ensure timely intervention for those patients who are worsening, to support timely medical and nursing decisions, to provide clear guidance and instructions to healthcare providers with regard to the use of early warning signs and their escalations protocols, to ensure patients' family education about the patient condition. What are the types of MUSE? There are three types according to the suitability of the patient age and the need. The modified early warning score is used for adult patients who are more than 12 years, the non-pregnant women, and the males, the women who are non-pregnant and males who are more than 12 years. The periodic early warning score is used for patients whose age is less than 12 years or below 12 years or 8-12 years. The modified early obstetric warning score is used for pregnant women until 6 weeks postnatal. The MUSE cases may include all women whose clinical conditions requires close observation, admitted in early pregnancy, antenatal or postnatal. All the postoperative cases in recovery and following transfer from theatre, any woman giving cause for concerns, whether medical or obstetrical, during or following APH, PPH, eclampsia, suspected infection like in the prolonged spontaneous rupture of the membranes, high risk women in delivery suits who are not in labor. What are these parameters on which we perform this scoring? These parameters are the respiratory rate per minute, the heart rate per minute, systolic blood pressure, conscious level of the patient, temperature, and hourly urine for at least 2 hours. So in the center, see here, in the center, the 0 mean these are the normal stage. The normal parameters. Respiratory rate 9 to 14 is normal if decreasing or increasing. So we have two sides, whether this respiratory rate is increased or this respiratory rate is going decrease. If the respiratory rate is increased 15 to 20, the score is 1. 21 to 29, the score is 2. If more than 30, then the score is 3. We label according to the rate of respirations. 15, 9 to 14 is the normal, that's 0. 15 to 20 is 1. 21 to 29 is 2. More than 30 is the 3. Coming to lower side, if score is less than 8, that is score 2. The second parameters is the heart rate. The normal is 51 to 100. If 101 to 110 is score 1. 111 to 129 is score 2. If the heart rate is more than 129, that is the score 3. Coming to the lower side, if the heart rate is between 40 to 50, that is score 1. If it is less than 40, then score 2. Systolic blood pressure, the third parameters, the normal is 101 to 199. That is in the range of 101 to 199. If it is more than 200, that is score 2. If it's less than 71 to 80, that is score 2. 81 to 100, 81 to 100, that is score 1. 71 to 80, that is score 2. Less than 70, that is score 3. The conscious level, alert, active, normal score. New agitation, confusion, score 1. Respond only to voice, score 1. Respond to pain, score 2. Not responsive, unresponsive, score 3. The temperature, normal is 36.1 to 38. Means 0, it's not normal, but it is 0. So temperature in the centidegree. 38.1 to 38.5, the score 1. More than 38.6 is score 2. The temperature is 35.1 to 36 is score 1. It's less than 35 is the score 2. Coming to the early urine for at least 2 hours, less than 45 ml per hour is score 1. Less than 30 ml per hour is score 2. Less than 10 ml per hour is score 3. So we monitor all these parameters on the MUSE scoring. We have higher side, apart from the 0, अगर वो इंक्रीज हो रहे हैं तब भी हम स्कोरिंग करेंगे, अगर वो डाउन हो रहे हैं तब भी हम स्कोरिंग करेंगे, राइट. सो सी व्हाट वी डू विथ दिस MUSE स्कोरिंग, द एक्शंस टू प्रिवेंट द पेशेंट डिटोरिएशन. अब हमें MUSE आ गए तो हमने कौन सा एक्शन लेना है टू प्रिवेंट फर्दर डिटोरिएशन. दैट इज डिपेंड ऑन द टोटल MUSE. The nurse should consider the following actions to prevent the deteriorations. First, she will verify that all components have been entered, so you know your score is accurate. These are the guidelines in the seriously ill and deteriorating woman. To detect the seriously ill and deteriorating woman, the modified early obstetric warning score call out cascade. This is the call out cascade. So MUSE 2, if our score is MUSE 2, कंटिन्यू करंट ट्रीटमेंट प्लान, जो भी चल रहा है उसको कंटिन्यू करना है और 2 hourly ऑब्जर्वेशन करनी है. इफ द स्कोर इज MUSE 3, inform the coordinator or senior midwife. Repeat observations. Senior midwife to review. Medical review if score is equal to 3 or on 3 of equal to 3 on 3 successive reading. अगर 3 रीडिंग सक्सेसिव 3 रीडिंग्स में स्कोर 3 आ रहा है तो यू हैव टू टेक इन अ मेडिकल रिव्यू. इसमें आपने क्या करना है, ये सारा मेडिकल रिव्यू आपने कर लिया. रिपीट ऑब्जर्वेशन कब कब रिपीट करनी है, परफॉर्म 1 to 2 hourly ऑब्जर्वेशंस. सो रिव्यू बाय सीनियर मिडवाइफ. अगर 3 कंसेक्यूटिव रीडिंग में स्कोर 3 आ रहा है तो मेडिकल रिव्यू. नाउ कमिंग टू द स्कोर 4 or 3 in the parameters or more than 4, perform half hourly observation. Inform coordinator or senior midwife. Contact obstetric SHO to review. If SHO unable to attain within 30 minutes, contact obstetric registrar or contact obstetric senior registrar. If the score is 6 If the score is 6, inform coordinator or senior midwife. Urgent medical review needed. Contact obstetric registrar and senior registrar. Contact anesthetic registrar. If doctors unable, consultant obstetrician on call should be contacted, or fourth on anesthetist should be contacted. Considered critical care outreach referrals. So these are the bleep numbers कि आपने किससे कैसे कांटेक्ट करना है, किस नंबर्स पे कांटेक्ट करना है. These are the bleep numbers. Think about airway when the score is more than 4 or more than 6. Mean think airway, breathing, circulation, left leg tilt if pregnant, increase frequency of observation, half hourly observation, record oxygen saturation, urine analysis, fetal monitoring. Think about all these and consider the sign of serious inflammatory response syndrome or suspected sepsis. Refer to sepsis bundle. If the score is more than 6, oxygen therapy, IV assist, fluid resuscitation, urinary catheter, analgesics, send the sample for full blood count, urea and electrolyte, LFTs, cross match, blood glucose, FBGs, septic screen, 12 hours ECG leads, transfer to CDCs or critical cares. So this is the MUSE chart, the MUSE obstetric chart. You will apply this MUSE chart in your cases who needs the monitoring, like in the APH, the PPH, the eclamptic, the septic patients, all the post-operative cases, all the cases who are in the ectopic pregnancy and you need the monitoring, and the laboring patients who are serious. So in the high risk cases who have certain medical problems, so in these cases you have to monitor the MUSE charts, MUSE warding score, and treat accordingly and involve the multidisciplinary team accordingly. Thank you. अगर एग्जाम में आपका म्यूज चार्ट आ रहे हैं और कोई भी आपको सिनेरियो वहाँ पे आ रहा है, यू हैव टू रीड द सिनेरियो एंड देन सी द म्यूज चार्ट कि कहाँ पे क्या प्रॉब्लम है और कितना स्कोर है. आपको ये आना चाहिए कि कितना स्कोर है तो म्यूज चार्ट कितना होगा, और देन ट्रीट अकॉर्डिंगली, आंसर अकॉर्डिंगली कि ये स्कोर है तो मैं इसको ये करूँगी, ये स्कोर है तो मैं इसका ये करूँगी, एंड देन दिस. In this way you have to answer your examiner very well, and not only the examiner answer but you manage your cases in your clinical practice very well. Thank you so much. Thank you.